The plan addresses 4 core themes: culture, patient and family engagement, workforce safety, and learning systems. So why focus on these elements? Dr. Brady.
Sure, yeah. I think, in addition to the, I guess I don't know that we've used the word frustration. Tejal said complacency. That's perfect. I think frustration with the complacency. Some of the frustration I think that we all feel, frontline clinicians, we who kind of try to support them with our work, is that patient safety is not really just one thing. Everything hangs together in that it's prevention of harm. But unfortunately, there are a lot of different ways that harm can happen. And I think part of the reason we settled on these 4 areas is because we realized that, I think Tejal said this best, in her examples as we were coming together and just kind of sharing what I think everybody appreciated. But, she's talked several times about, kind of feeling like we're playing whack-a-mole, all of these different problems that we keep hitting, but they keep coming up. And that's just the nature of, again, the complexity of healthcare. So I think the 4 areas are a way to sort of get at that and try to cover, a broader sort of waterfront, if you will, and also be somewhat evergreen and applicable to a wide range of problems. Inevitably, we're going to need to continue to advance safety and focus on individual technical issues. That's always going to be the case, just like every other aspect of healthcare. But these foundational things are again a bit more evergreen and kind of will almost surely be applicable, for the long haul. Even they may need to be adapted, tweaked. We'll hopefully learn more and more about them. We're still learning. But I think these are things that are going to be with us for a while in a good way, and they have applicability to almost every safety problem. And then I think, probably to put a term around it, it's the importance of systems thinking and patient safety. And I think these foundational areas represent a lot of important basic aspects of the system.
And just to build on that too, we also wanted to make sure this work was not duplicative of existing great work that has gone on. And we know there have been initiatives around specific topic areas for specific problems like medication safety or infection prevention and so forth. And so we wanted to make sure that this was different. There's no point reinventing the wheel. And then I think just to echo what Jeff said, what I've often said is, we wanted to create that fertile soil, right? That's the foundation, because you may have your initiative on whatever the safety issue is, but if you don't have the fertile soil, it's difficult for that initiative to thrive. And so to us, these foundational things create that fertile soil. So then, your initiative on medication safety or teamwork or whatever it might be is going to have more likelihood of success because you've built some of these foundational elements and have them in place. And so I think, it sometimes can be hard to focus on the foundational things because of that game of whack-a-mole where you're just trying to put out the fire of the day. And so to have this group really focus on those foundations, we thought was bringing something new to the field and also then helping build that fertile soil.